Hi, I'm Dr. Wilkinson. I'm a podiatrist and I treat a wide variety of foot and ankle conditions. And one of those conditions that I want to talk about today is called onychomycosis. So onychomycosis is just a fancy name for nail fungus. There's a lot of treatment options out there. So the goal of this video is to try and give you some insights on what might be effective for you. Okay, when we talk about onychomycosis, there's different stages, and you have mild, moderate, and severe. Your mild cases are basically nails that tend to be a little discolored and they're still pretty thin. Your severe cases are nails that are much thicker and the discoloration involves the entire nail. Okay, our first category is topicals. The topicals include a lot of different treatment options out there. There's home remedies, there's over-the-counters, and there's prescription-grade topicals. The take-home message with topicals is that the success rates tend to be pretty low. You're looking at success rates around 30% or less. Our second category involves laser therapy, all right? Laser therapy, success rates tend to be pretty low as well. There are some studies out there that do show some decent success rates, but by and large, the general consensus, the randomized trials that we have show that laser therapy tends to be pretty ineffective by itself. Our third treatment option, which is our most effective treatment option, is our antifungal pills. These are prescriptions that you have to obtain. The success rates with the pills are much higher than the laser therapy or the topicals, and that's because they get into your bloodstream and they can be directly delivered to the nail matrix, which is where the dermatophytes reside, and it has a much better chance of eradicating the nail infection. All right, so the pills tend to have success rates of around 75–80%, sometimes even higher, especially if it's a more mild or moderate case. Sometimes we see higher success rates than that. I should mention there's a fourth option for treating nail fungus, okay, and that's a nail removal procedure, okay? All right, so a lot of patients that let it go too long, they can develop those severe cases, and sometimes that leaves you with permanent damage to the nail matrix. So this is an important thing to understand. It's really important to treat the nail early on. That's where we're going to see the highest success rates. The longer you let it go, it will eventually spread, and the nails tend to get thicker, and it can leave you with permanent damage. So if you want to see if you're a candidate for any of these treatment options that I've mentioned, whether it's a prescription grade topical or a prescription grade pill, then just click the link below and we can get you scheduled for a telehealth visit and see if you're a candidate for any of these treatment options.